Future of Health series. We're very excited to discuss our vision for the future of public health with you, and at the same time share some real-world experiences from our members, and that's what this series is all about. I want you to note that we are recording today's webinar, and we will make the slides and recording available afterwards. We're going to be taking questions also at the end of the webinar, so please use the Q&A function at the bottom of your screen. There tends to be a lot that goes on in the chat, so probably best to use Q&A rather than chat to ask questions, and I'll be monitoring that as it goes along. And we'll try to address as many of those questions as possible, but we may not get to all the questions before the end of the webinar. So with that said, let me turn things over to the Executive Director of the Big Cities Health Coalition, Chrissy Giuliano.
Thanks, Elizabeth, and thanks everyone for being here today. Really great to have such a large group of folks on the webinar and our special guests. So we have here today Sandra Castillo and Natalie Goodnow, both from Austin Public Health. They're going to share in just a few minutes what they and their Austin Public Health colleagues have learned as they've worked to put their racism as a public health crisis declaration into practice. That story is interesting enough, but it's also part of a larger story about racial justice and the future of our public health field. So I want to start by just briefly setting up some broader context. So for those of you who don't know, the Big Cities Health Coalition is the forum for big city health department leaders to share best practices. We strategize together on how best to address complex urban health challenges and advocate for urban health, health equity, and the public health field as a whole. In this webinar series, we have teased apart some of the core concepts in our urban health agenda and show how these ideas are being put into practice in our member jurisdictions across the country. So we'll discuss a few of the urban health agenda key concepts today, but as you can see, you can learn more on our website via the QR code or the navigation. So our urban health agenda rests on the premise that we must dismantle structural barriers and systems that are built on generations of racism. Inequities, as we know, are baked into so many of our institutions, laws and policies, our institutions, laws and policies. So the key takeaways for us are we built that system so we can undo it. And if we merely provide additional services to the underserved, we're not facing the larger problem. So uprooting these inequities helps us all. The health of everyone in a community is threatened, as we know, when people in neighborhoods within the same city have life expectancies that differ by decades. This means we must change more than programming in our communities. You know, we all put programs into place, but we've really got to dig deeper and start to change inequitable structures and practices. So we like to say that we must work with our communities, especially those that have experienced the most discrimination and the least healthy outcomes, to determine together what will create lasting health and resiliency. We also need to advocate to dismantle systemic barriers so everyone in our communities can live their healthiest life, regardless of where they live, work, or play, or their race and ethnicity. To take a deeper dive into this shared mission, we really have to uproot racism from all facets of the health system. On the screen, you can see our brief that we co-authored with Prevention Institute about centering racial justice and lessons learned from COVID-19. With that bit of stage setting, I want to again welcome our guest speakers, Sandra and Natalie, who can talk us through a striking example of what it means to commit to dismantling the impact of racism in our community's health. So again, thank you both for being here. We're so happy to have you. I will turn it over to one of you.
I think I'm getting us started. Thank you so much for inviting us. It's really a huge honor to be asked to speak to this audience. We're really excited to share where we're at in this part of our journey. And we look forward to hopefully connecting with y'all in the webinar, in the Q&A and after this call also, so we can keep learning from each other. So I do want to share a quick disclaimer that Sandra and I are going to do our very best to do our organization justice, because there's actually a lot more going on than we're going to be able to cover in the time that we have for you today. But we're excited to share some highlights from the current stage of our journey. Let's see, who's sharing slides? We could go ahead and start moving through the slides now.
I'll be you, Natalie.
Oh, that's me. Okay, well, no wonder. You told me that earlier, and then I think I misheard something. So I'll go ahead and do that. Thanks for your patience. I think that's part of the zeitgeist, I think, these kind of Zoom interactions. Okay.
100%. When you have to go to a conference, you like plan 10 times who's going to have the slides and what they're going to look like, right?
Yeah. And yet there's still these moments. Okay, thanks for your patience. Here we are. All right. Okay. So here's an agenda of what to expect in this presentation. Sandra and I will introduce ourselves and introduce a little bit about Austin Public Health in general. We'll talk about the learning objectives that we have outlined for this presentation, and we are going to introduce a framework that we've started to implement into our efforts to advance racial equity, diversity, and inclusion at Austin Public Health. So, Sandra, would you like to say a little more about yourself real quick?
Yeah, good afternoon. Thank you everybody for joining. Sandra Castillo. I use she, her pronouns. I'm the Equity and Inclusion Coordinator at Austin Public Health. And I've been in city government, going this month will be my 13th year, but very new to public health work. I've been with Austin Public Health for a little bit over a year and a half. So like Natalie said, the work that we're doing is truly based on the foundation that our department has done prior to us being onboarded.
Thank you. I'm Natalie Goodnow. I use she, her pronouns. I'm a training specialist senior with Austin Public Health. I feel very fortunate in that role that I get to focus very specifically on equity training for our staff at Austin Public Health. I am relatively new to working in city government. I've been with Austin Public Health for almost 2 years, but not quite, just shy of 2 years. Prior to that, I was working in community arts education, where my focus was on using creative and interactive methods to foster dialogue and learning around different kinds of social issues, with some particular focus on racial equity issues. So I'm also new to public health, relatively new, still learning a lot. In retrospect, I see now that the issues I was working on before were also public health issues. I just didn't necessarily have that lens at the time, but I'm still learning a lot, of course, about how local public health departments work, and also drawing from institutional change efforts in my previous field as well as I'm doing that. And like Sandra said, I'm the implementation team. A lot of the important work that happened to get the department to the point where they could hire an equity and inclusion programs coordinator and a training specialist who's focusing on training around these issues happened before my time. So I'm very honored to be building on that work. All right, so just briefly a little bit about Austin Public Health. We are an accredited health department through the Public Health Accreditation Board. We provide services to over 1.2 million residents of the city of Austin and Travis County. Our workforce currently consists of 294 general fund full-time staff and about 150 grant-funded staff. And our last fiscal year total budget was $156 million. So just to give you a little bit of a sense of kind of the size and scope of our department. And here are the learning objectives for today. So we are going to be sharing a framework that we've learned from the Government Alliance for Race and Equity that's about visualizing, normalizing, organizing, and operationalizing. And then we'll share about what that currently looks like in our department. And you may notice that as we discuss this framework, that many of Austin Public Health's current efforts intersect with different parts of the framework. And some of what we're doing could fit in 2 or 3 different parts at once. So something that we're doing could be normalizing the conversation, but it's also organizing at the same time, for example. These things, you know, life is complex. We can't always divide things into these perfect, neat little boxes. So You might notice that. That might come to mind as you're reflecting on what's happening in your institution as well. We also wanted to acknowledge that we're going to do our best to share where we're currently at in our journey in this work. But of course, that doesn't mean this is the only way or that it's the best way or the best way for you and your institution. So we hope you'll take inspiration from whatever feels most relevant, even if it's just little pieces here and there.
And so I want to start off by giving an overview of the framework. The framework comes from the Government Alliance on Race and Equity, or GARE, which is a national network of governments working to achieve racial equity and advance opportunities for all. GARE is a joint project of the Center for Social Inclusion, now merged with Race Forward, and the Haas Institute for Fair and Inclusive Society at the University of California, Berkeley. So we didn't invent this framework. We are adopting it and using it as we can within our organization. The framework has different components, and as Natalie stated, efforts can intersect with one another and may simultaneously be applicable within multiple segments. And as we go through the different segments of the framework, make note of some of the things you can do within your organization. You don't have to take this and implement all of it. You could see little pieces that might fit and might be easy implementations for your organization. Take it. And, you know, this framework is a circle for a reason. Because we're going to go through different aspects of it. And this is our iteration of where we're at now. 5 years from now, we might be looking at this and be in a completely different iteration of the framework. So just keep that in mind. And with all of that said, we do like to start with visualization. In visualization, we take the time to visualize what a just multiracial society looks like and what that change means if we can eliminate significant racial disparities. So to do that, we must normalize the conversation on racial equity by achieving a shared understanding of key concepts. A racial equity framework sees racism as both individual and institutional, both explicit and implicit, and everyone needs to share in that understanding. Once everyone's on the same page, we can treat the issue as a top priority by setting goals, making a plan, and holding ourselves accountable. This will help to collectively create a greater urgency to achieve racial equity. Bringing about change also requires us to organize both internally and externally. Internally, there needs to be the infrastructure to build expertise on racial equity. Externally, organizations can work with others who are seeking change from a different but related perspective to have a greater impact in their community. Operationalize is the other fragment of this framework, which in operationalizing change means having the tools and information to make change and track progress. Internal and external assessments, activities, and guidelines help us follow tried and tested practices in implementing strategy, and data also plays an important role, allowing us to create a baseline, set goals, and track our progress towards those goals. Next slide, Natalie. So we will now take a look at the different segments of the framework. And as stated, the first thing we do is visualize what a just multiracial society looks like. And for us at Austin Public Health, that manifested in two different types of ways, at a larger city level and then at our department level. At the city level, it looked like the creation of the City of Austin's Equity Office. We highlight this because so much of what was done at the city level helped set the foundation for what we're doing internally in our department. This level started in 2015 when our city council passed a resolution directing our then city manager to evaluate the impact of existing city policies and practices on racial equity, as well as develop a racial equity tool. So in 2016, the Equity Office was created and we hired our first ever equity officer. And this was done with the work of the Equity Action Team, which is a group of community members. And the focus of the Equity Office was advancing equity in all aspects of city operations, working alongside the Equity Action Team to co-create the Equity Assessment Tool. In 2017, APH was one of the first cohorts to participate in the equity assessment, which led to our next level of visualization, the department level. This next level of visualization, the department level, started by taking the results of the equity assessment and creating an action plan. I do want to pause to highlight that internal efforts were being made in the department to advance equity throughout this time. For example, there was the creation of our Health Equity and Community Engagement division. However, the events in the summer of 2020 and COVID really pushed efforts forward. specifically with the resolution passed by our City Council in 2020 declaring racism a public health crisis. The pandemic also made us take a hard look at our work and forced us to shift our focus to the work we are currently doing. COVID response efforts highlighted a need to embed equity in all aspects of our operations. This included task forces formed to address the health disparities in equitable and culturally specific ways within diverse communities, as well as the creation of an equity line for people proficient in a language besides English to respond to digital inequities when registering for tests and vaccines. In recognition of the work that was happening, the department created the Racial Equity, Diversity, and Inclusion Plan, or our READY Plan. This is our department-level equity policy that provides a framework for employees throughout APH to build a more culturally inclusive workforce. This plan is our way to keep ourselves accountable to the communities that we serve, and recognizing this plan's approach is an intersectional one that leads with race. This approach means we consider all forms of oppression and marginalization and all the places where our multiple identities intersect and overlap, but begin the conversation with race. We lead with race because, unfortunately, it is the most consistent predictor of outcomes nationally and locally. And an intersectional approach strengthens this focus to ensure that community members uniquely impacted by race and other forms of oppressions have their needs met.
And from Visualize, the next part of the framework we'll discuss is Normalize. And as a reminder, in this part of the framework, an organization normalizes the conversation on race. And that means creating a shared understanding of race and racism and generating some shared definitions that allow us to speak about race effectively together. This also means we developed a shared analysis of race and racial inequities. And finally, it means coming to a shared understanding of the urgency of the problem and the need to prioritize doing something about it. At Austin Public Health, our primary strategy for doing this across the department is currently something we're calling the Austin Public Health Equity Academy. So here you can see the core goals of our Equity Academy. It helps staff to develop a shared framework and vocabulary for understanding and discussing how racist inequities and other inequities persist, even in the absence of explicit intentional discrimination. And something I usually say when I'm introducing this to our staff is, there are people out there still, unfortunately, who are doing unfair things on purpose, but we don't really need an academy to understand why people doing these things on purpose would lead to inequitable outcomes. Where it gets harder to understand, harder to wrap our heads around, harder to articulate and talk about is when it's happening unintentionally. And you can see some bullet points that break down some of the key terms we use to help us wrap our heads around that, to talk about it, to identify it. So there's systemic racism, implicit bias, microaggressions, and intersectionality. And we're doing all of that so we can identify how this work happens in our work in public health so that we can generate, learn, practice, and normalize the use of tools and strategies for doing something about it. Because of course, that's what all of this is for, so we can more effectively work together to end health inequities in our communities. And this Equity Academy is something that is required for all staff across the department. We've begun integrating it into our new employee onboarding, and we're in the process of getting this curriculum out to all of our existing staff, starting with our managers and supervisors right now. And then in 2024, at some point in 2024, we'll start bringing this curriculum to our existing staff who are not managers and supervisors. And the way the curriculum is structured, there are 3 courses, so you can see the titles right there. The last one really focuses on health equity, but health equity is woven throughout all 3. Just the last course is where we get more focus on how all these other things impact our health and what we can do about it. Each course includes an e-learning component, so something that people do on their own computers, on their own time, in their own space before they come to a classroom session. And the whole curriculum totals about 16 hours of content. We roughly modeled that after the ICS training, the incident command system training that folks in many jurisdictions across the country and other kinds of agencies are required to do, just because that's something that is challenging for our staff to do, but we find a way to do it because it's important. So we figured this is important too. It'll be challenging to have every single person in our agency do it, but we can do it. And our Equity Academy is, the classroom sessions are co-facilitated by me and a group of staff that we're calling Equity Ambassador Training Facilitators. So the training facilitators co-facilitate those sessions with me. They receive some training on facilitating learning through dialogue about equity. We also have another subgroup of equity ambassadors that we call informal learning leads or leaders. And their work is to encourage informal dialogue on equity topics with colleagues. And they receive some training on how to informally foster dialogue about equity through more informal conversations. And the reason we got the informal learning leaders started is because we came across some research on workplace learning that indicated that around 70% of workplace learning happens through informal interactions with colleagues. And so we felt like, wow, that's a lot. So that's something that deserves some intentionality, some strategy, some focus, some support. It doesn't mean that the training part is unnecessary or unimportant. Hopefully, if we have that shared framework and vocabulary that we get through training, then the informal conversations go better and are easier. But we definitely wanted some focus on both parts of learning on these topics. Another couple of things that we've just started recently within the past 6 months are our Ready Report and Ready Roundtable. And these happen on the first Thursday of each month, and we alternate between the Ready Report. So for instance, just last week, we started off October with our Ready Report, and then in November, we'll do the Ready Roundtable. Then December, we'll be back to the Ready Report, so on and so forth. The Ready Report is a space that happens online on a Teams meeting where we can share information and updates on racial equity initiatives. Each month we spotlight some kind of equity work happening somewhere in our department. Something that I've been really enjoying about how the Ready Report is shaping up is that it has become just this really encouraging celebratory space for us to cheer each other on for the small wins and the lessons learned and ongoing commitment to this work. There's definitely a time and a place for asking ourselves hard questions and encouraging ourselves to do more, but I'm really happy that we're also making regular routine space to celebrate things that we are doing. And we've had around 30 people show up to those. Our most recent one was closer to 50 though, so we're really happy with how that's shaping up. Another thing that we started even more recently was our Ready Roundtable. It happens in person where people can engage in conversation about equity issues. In the Ready Roundtable, we're focused more on learning about these issues by learning about each other's racialized experiences. And we've just done one of those so far and had about, I think around 25 people show up, which we thought was just excellent for the first one. So very excited about that as well. I'm excited to have both of these ongoing opportunities so that even after people are all done with the Equity Academy, there is something really regular happening that they can keep plugging into, no matter what their role is in the department or where their specific unit or program is at in this work.
And now we come to the organized segment of the framework. Bringing about change also requires the ability to effectively organize. Internally, there needs to be the infrastructure to build expertise on racial equity within our department, and externally, it's how we collaborate and co-create with others who are seeking change from different but related perspectives to have greater impact in the community. Next slide. An example of organizing at Austin Public Health is the creation of our Communications Equity Review Committee, or CERC. This committee was created as a response to cultural mishaps or failures. I hate to say that word, but we did fail to reach out to our most marginalized communities in our messaging, campaigns, and social media posts during the pandemic. This was brought to our attention by our own staff and the community members that we have built that collaborative relationship with. We realized that there was a need to make our health services more accessible by addressing the social determinants of health, and that from a communications perspective could not be done without addressing the content in our messaging and outreach materials. CERC consults with the communications and marketing team by reviewing and providing feedback on all APH branded public-facing communications and messaging. They ensure that the content matter, images, and to some degree the graphic design is culturally and linguistically appropriate, inclusive, equitable, and easy to understand for all communities. CIRC is comprised of APH staff representing diverse cultural backgrounds, intersecting identities, various immigration statuses, expertise, and languages on languages beyond English and Spanish, plus a liaison from our communications and marketing team. Next slide. Another way that we build our internal infrastructure and organize is our Equity Council. This council is composed of staff from all divisions across Austin Public Health. It's currently 25 strong, actually, and it oversees the implementation of our racial equity and diversity and inclusion plan by making recommendations to our department director, our executive leadership team, and our human resources department. This is the second year we've built out the Equity Council, and year one was definitely a building year, and we're looking to go into our active year this coming year. We want to highlight another important group that builds the infrastructure from the inside out, and that's through Everyone's Quality of Life Initiative, or EQUALLY, which was formed to give a voice to our LGBTQIA+ staff. In addition to the quarterly lunch and learns, participation in Austin's annual Pride event, hosting an annual health fair geared towards our LGBTQIA community, they do a lot. They also spearhead a yearly survey to provide the department with feedback and insight regarding steps to continue focusing on improving services and the work environment for our LGBTQIA+ staff. So externally, we're still building out our network of partners. Some external partners that we have direct relationships with are our partnerships with the City of Austin's Equity Office. They really lead this work at a city level, and we try to follow in their footsteps in what they do. The Equity Network, which consists of city staff that focus on racial equity efforts in their respective departments, and whenever possible, participate in the Equity Action Team meetings because that's community-centered. Additionally, we continue to build our external collaborative partners in our community through community events and outreach. Our CHA chip process, to help with that, we host customized and culturally specific health fairs to meet the needs of communities that are most marginalized and who ordinarily don't have access to health services due to language, cultural, socioeconomic factors, with a goal to meet our communities where they're at. We also offer a monthly video broadcast specific to our API communities that gives information about culturally relevant community events, topics to marginalize conversations about mental health, among other things. And that English version is then dubbed into Mandarin, Vietnamese, and Burmese. We have our maternal infant outreach program that's specific for our Black moms who are either pregnant or just gave birth, and they're able to receive wraparound services. So these are just a few culturally grounded programs that we wanted to highlight as we build our external community partners, because community is such a powerful ally in our work. And we understand that those relationships need to be nurtured and assure that they're not transactional as we continue to move this work forward.
Also part of the zeitgeist, you're on mute. Okay, now we're moving to the last piece of the framework, operationalize. So that really means, how are we doing something about this, putting all these ideas into action, into the way we work on a daily basis. And ideally, we're doing it with the teams we've assembled in the organized step. So in order to operationalize this work, we use tools to change the policies, programs, and practices that are perpetuating inequities, as well as used in the development of new policies and programs. Data obtained at the programmatic and community levels is needed here to demonstrate measured results. And at Austin Public Health, we are using some tools that have been in place at other organizations, as well as creating tools that are more specific to our department. So one of the things we've done to operationalize our commitment to racial equity, diversity, and inclusion at Austin Public Health is hired a human resource specialist with a focus on equity in hiring. And she's just doing a ton to build relationships with community partners, get the word out about Austin Public Health as a place to work. And really, I think a lot of what she's doing, what I've heard her talk about, is just letting people know that public health is more than just COVID and more than just COVID shots. I imagine many of y'all experienced something similar where we got a big spike in visibility around that aspect of public health, but she's letting people know there's lots of other things we do that we want to invite people to be a part of with us. And Sheila is our staff person who's working on that. Prior to her coming on board, Austin Public Health was doing around 5 job fairs a year. Now we're at about 52 job fairs and community events. So it's a pretty big change in the scope and scale and nature of our outreach. So we're really excited about that. Which is developing some systems to keep track of all these contacts and really try to quantify the difference that it's making. And another thing that has happened recently is purchasing Clover's AI. It's a job description tool. So it takes a look at the language in job postings and flags any words that have been shown to dissuade certain groups from hiring. So for example, it can identify words that seem to have dissuaded women from, from applying to certain jobs, or just to give an example. And the software also suggests alternate wording. So we just purchased that and we're excited to try that out and just see what it can illuminate for us. Another of the tools we're using is the Bar High Organizational Self-Assessment. So this is a self-assessment toolkit that is made specifically for local health departments, and it is meant to help establish a baseline measure of capacity, skills, and areas of improvement to support health equity-focused activities. At Austin Public Health, we're currently focusing on using the staff survey and partner survey parts of this toolkit. The staff survey is currently being analyzed, and we hope to have an executive summary of the results very soon. And we all are also planning to launch the partner survey this fall. We also are using a language access plan. So the plan that we have is based on a language justice framework with the main premise of not only helping us to decentralize the predominant language, English, but also working towards a space where we can allow all parties to speak to and understand one another with ease and comfort. So one way we do this is by restructuring how we say things. So for example, in this plan, we're moving away from saying limited English proficiency and instead towards person proficient in another language. So trying to focus on what people can do and thinking about the language barrier, not as the communities, but as our language barrier if we're not able to speak to them in the languages that they're proficient in. We're also working to maximize the use of language access services, in-person interpretation, video interpretation, or call-in interpretation. This is alongside translated materials for all outreach services and communications. The group you heard about earlier, the Communications Equity Review Committee, is also inserted into this plan when it comes to reviewing any and all translated materials coming through our communications team. And one thing that we can share is that we saw a huge increase in the use of language access services across our department over the course of the pandemic. So we consider that a big win, and our language access team is now having a moment where they have been able to step back and do some bigger picture planning in a really proactive way. And that's what we've seen coming into fruition in the development of this plan. And lastly, another tool we're in the process of developing and implementing is a racial equity decision-making framework designed to integrate explicit consideration of racial equity in our decisions by asking a set of questions about the proposal, the data, community engagement, analysis and strategies, and about who is benefit, who is burdened, and what will we do about implementation, and then lastly, accountability and communication. So this tool is different from the Bar High and also different from the equity tool that was created at our City of Austin level that you heard us talk about in the Visualize section. Both of those tools are meant to help us see kind of a snapshot in time of how the department as a whole was doing and is doing to serve the community. That's the focus of the Equity Office's assessment tool in our city, or about our capacity to work towards health equity and address the social determinants of health, the emphasis of the Bar High's toolkit. So this tool, this framework is meant to serve as a guide for tackling one particular equity problem or a challenge at a time. So we're imagining that those kind of broader assessments would give us like a lay of the land. And then when somebody says, okay, our program or our division wants to focus on that one, or our unit is going to focus on that one, this is something that could help guide people in how do we do that? What are the questions we need to ask ourselves and the steps that we need to go through in order to do that? So this is meant more to guide a more dynamic process, shaping decision-making in real time on an ongoing basis. So all these tools are helping us operationalize our work by changing the policies, programs, and practices that are perpetuating inequities, and as well as using them in the development of new policies and programs that are more equitable. I feel like we're still at the beginning of this phase of operationalizing, but we are seeing some exciting progress. And ultimately, the goal is that the data obtained from the use of these tools will help us to demonstrate measured results.
And so all that we're doing and looking to do is not without its challenges. But we are privileged in having support from our director and our executive leadership team. We are cognizant that we reside in a state where these efforts are consistently under attack. We continuously push the limits with our leadership, since so many of the health barriers, inequities, and disparities that were highlighted during the height of the pandemic showed us how much more work is needed to serve all the different populations with so many varying needs and desires. The reality of all of our work is that health disparities exist disproportionately in communities of color, and as such, our health equity efforts cannot be addressed without addressing racial equity first, which is why we lead with race when we speak of our services, which, to be quite frank, is not always well received, both within, internally, and externally. We also know that this work cannot be performative, and as such, it needs to be funded. Many of our efforts are byproducts of the work we did during the height of the pandemic, and as such, are grant funded. We work hard to make sure that this work is embedded into everything that we do, so that if we ever lose our grant funding, it lives beyond our positions. Additionally, on a yearly basis, we look for individuals to fill our equity groups, right? You heard about our different equity groups, because we understand that our team cannot do this alone, but have come to realize when we're looking at who's looking to participate is that our frontline staff is not heavily represented in that. So we're continuing to think of ways to have all staff participate in these initiatives while understanding how to manage requirements that might prevent them from doing so. With all of that said, we're still here as movers, shakers, agitators to move the needle to create that paradigm shift so that people are no longer surviving, but thriving. We hope that we've inspired you to move the needle in some sort of way. We hope that you've taken a nugget of something that you've heard here that you could implement within your own organization. And we encourage you to think outside the box, be creative, and see you in the next webinar so we could take tips from you all.
Great. Sandra and Natalie, thank you so much. And we do have a good bit of time left, excuse me, for questions. We've got some in the Q&A box already, and a number of you submitted questions when you registered. So I'm actually going to start with a question that came up in the Q&A box, and then kind of tie it to some other questions that we received during registration. So one of the questions we received was, I may have missed this, but are you able to require DEI training at Austin Public Health? And if not, how do you gather buy-in for staff to attend your Equity Academy? The questioner says that here in Arizona, we have state laws that prohibit us from requiring DEI training. So our DEI training is not mandatory. So I think in addition to kind of talking about some of the specifics of how that works in Austin, I think this kind of suggests some larger questions about how you navigate that tricky political space that there is right now about talking explicitly about racial equity and addressing it in the workplace and in public health, and just how you kind of navigate that in Austin. I mean, I think there are a lot of people represented on the call who, are similarly in political environments where it's not straightforward to be able to require these kinds of trainings or act on these declarations. So if you could just kind of maybe talk specifically about, can you require these trainings, but also kind of address that larger issue of, just some of the ways that you navigate some of that tricky political space.
Sure. Yeah, I can speak to that. In Texas, there has been some legislation prohibiting some of this work at the state level. We are still able to require this training in our department because we're not a state agency, we're a local agency. So we do require participation in the Austin Public Health Equity Academy. That being said, I do believe there's pros and cons to requiring training versus having people who really want to do it and want to go deeper sign up. Even if people are not able to require training on these issues in their setting, that's okay. I think there can be a lot of advantages to having people who are excited to be there come together. And I think if you have those people talk about what they shared, talk about what they learned, talk about what they experienced, talk about why it was meaningful to them, how it's supporting their work, and invite their colleagues in, then the work will grow and you'll get more and more people in those trainings and in the conversation as part of this work. And this is reminding me of something that I didn't mention quite yet, but we actually are using a combination of these strategies in our own work. So we do have the Austin Public Health Equity Academy that's required for all staff in our department. We also have a training that the People's Institute for Survival and Beyond, they do a training called Undoing Racism that our city's equity office uses as the foundation of their work across the city. And they prefer that people not be required to be in that training. It's a very powerful experience. It can really challenge people in some really important ways. And they find it works better when people choose it. It just makes the whole training feel differently and go differently. And so in all of the things we're doing to help normalize this conversation, we're also constantly letting people know, hey, if you're enjoying this, if you're energized by this, if you want to go deeper, if you want to go more, please also know that there's this other thing that's more intensive called Undoing Racism that our city's equity office coordinates on about a monthly basis. And we can help you get connected to that. And we've had a number of people in our department participate in that as well, and have been really, really very moved by it. It's a more intensive 3-day training, 3 full days in a row. And I also wanted to talk to just kind of in general navigating some of those tricky political environments. Let's see if I can share my screen again. I prepped a slide because I had a feeling we were gonna want to talk more about this. Okay, there we go.
You anticipated getting this question?
Of course. If it were easy, we wouldn't be having this webinar, right? So this tool, the spectrum of allies, is something that I've learned from community organizers, and I've found myself bringing it up a lot. I've found it really helpful, and I hope y'all will too. Can you see it? Yeah, okay, great. So I find that when we're talking about this work and people who are not in supportive of it, often what people are well, actually, let me rewind a little bit. So we can think of all the people out there, you know, not just as a block, but kind of divide them up into who is truly neutral. They haven't made up their mind one way or the other. Who are the people who are passive allies, who do support the change we're trying to make, but maybe they just aren't doing anything about it quite yet? And who are the active allies, who are actively taking some kind of action to make this kind of change happen? And then on the other end, we also have our passive opposition, people who disagree with what we're doing, the kind of change we're trying to make, but they're not doing anything to stop us. They're not helping us, but they're not doing anything to stop it. And also our active opposition, who disagree and they're trying to stop it, and they're attacking it in some way. They're trying to make it harder to do what we're doing. And what I find is when people ask this question about how do we work in hostile environments, or how do I deal with people who are not on board, sometimes the question that they're asking is like, how do I take someone from active opposition and turn them into active allies? And how can I do that over the course of one training or one conversation? And my answer for you is you don't. You can't. I used to work with young people. With young people, sometimes they will flip that fast. With adults, no, that's not a realistic expectation. Instead, our expectation, our goal can be in each conversation, in each training, just to nudge people a little bit over, just one more step on the spectrum. So our passive allies, just in what I've learned from this framework is let's just think about who are the passive allies we know, and what do they need to become active allies. And some of those people, it's really simple. They just need an invitation. That's literally it. They just need an invitation. Some people, it's a little more. They need some encouragement. Maybe they're afraid. Maybe they need to know they're not alone. Maybe they need some validation. Maybe they have some ideas, but they just don't feel very confident. So they need some validation that they're on the right track. maybe in some instances, people need a clearer understanding of the problem. You know, that idea is still out there that this is just about hateful people doing hateful things. And sometimes a clearer understanding of, okay, it's not just that, it's also these implicit biases, it's the structures we're working in can lead people to more strategic ideas about how to become active allies. And I find that those conversations with passive allies about how to become active allies are so fun. They're so energizing. You know, this work does not need to be a constant grind. I think focusing our energy there is just such a wonderful place to be that helps make the work sustainable for us on a daily basis. For folks who are truly neutral and haven't made up their mind, maybe they need more information. Maybe they could find that helpful. For those folks, the history of these systems and how they came to be in local government and public health, looking at data about the outcomes. Some of those folks need to see that stuff, and then it'll convince them to at least become passive allies. Passive opposition, maybe sometimes some of that data can be helpful as well, but we don't necessarily want to overdo it. It's paradoxically, sometimes when you throw too much data at people, then they feel like you're like trying to coerce them or manipulate them. And then for our, but a little bit of that kind of data can be helpful. Sometimes also just stories from the heart can be more effective there, of just here's how I understand this, and this is why. This is how it has affected me personally, or affected people I care about, or affected people in the community in a way that is really meaningful to me. And then for our active opposition, sometimes it's just letting them know that if they continue to act on these ideas, it's not going to go very well for them. You know, we don't need to convince them of anything except that continuing to act on these ideas is not going to be great for them. And I think pointing to something like the newest public health accreditation board standards can be really helpful, where equity is really centered as in all our work in public health, just saying, okay, this is where our field is moving. This is part of the standards of practice of what it means to be a public health professional now. And if our agency doesn't demonstrate how we're moving forward on this, we're not going to be accredited. So if you as an individual or a policymaker or what have you are standing in our way of doing that, that's not going to go well for us, and it's not going to be a great look for you either. And I don't mean to just totally dismiss the active opposition. I truly do not believe in treating people like they're disposable. They're not. Some of those people do come around, but it takes a long time. You know, it can take a lot of patience. And paradoxically, the way we convince some of those people to come around is by not trying to convince them. And there is data on this. I think it's probably more than I can go into at this moment, but there's a collection of strategies called deep canvassing that has also been used in different kinds of organizing, that there is some evidence to show it can be more effective than other strategies in moving our active opposition and getting them to be active allies eventually. But it's going to be many conversations, just a little bit at a time. And that set of strategies is a lot about just listening to people, just asking them, would it be okay for us to have a conversation about how you see this and I see this, and maybe we could both understand each other a little better, and then truly listening, truly trying to understand them, finding some point of connection, and then sharing, here's a different way that I understand it based on, okay, teeny bit of data, but mostly what touches my heart, and offering that in a spirit of a gift, not with manipulation or coercion. I think sometimes people approach these conversations with a sense of desperation, like I have to convince them, they're the one standing in the way, and if I don't convince them, it's all for naught. But I actually truly believe that we have enough neutral and passive allies that we don't even need to think about them. You know,
Yeah,
so if some of them come around, great. If some of them don't, that's also fine. And one, well, I'll pause there because that was already plenty of talking about that one.
No, but you're right. It's a complex issue, and it actually kind of dovetails nicely into a set of questions that we've also gotten about how you sort of measure the results of this, you know, in both the short term and the long term, in terms of you know, how do you sort of measure the effectiveness of these trainings or some of the other programming that you've put into place? And you know, you may not have seen the results from this yet, but just kind of, if you could talk a little bit about how you're assessing the forward motion on the initiatives that you're doing now.
I could speak a little bit on that, but I want Natalie to touch base on like some of the smaller things that we've seen, because we've really have seen that with our Equity Academy trainings and people going in and what they come out with and some of those action items. But yeah, like you said, Elizabeth, we're in the measuring stage of this, right? With the bar high, the staff survey, getting a SWOT analysis from that, looking at areas where we could measure. We're still trying to figure out what's our baseline. What is our baseline to be able to see, did we move from here to here? We also are very cognizant that doing a culture shift in a state like Texas is not going to happen overnight. This is hard work. So some of the things that we focus on that we measure in a very like not defined way are our small wins. We went from when we did the Ready report, we had a handful of people. This time we had 50. That's a huge, huge shift. We provided undoing racism as an optional training for individuals. People came, and then we had the amount of interest in that training multiplied since the last time we set it out. So like small wins like that have really showed us that it's just like, okay, we're shifting things in the right direction. We're moving that line. With that said, we know we have to work off of data and actual forms of evaluation to show like, hey, this is how we've moved things. And we're looking at ways on how to quantify this work, right? And it's just like, we're not quite there yet in that aspect of it. We're still learning how to do that. But it's the smaller things that right now that we're seeing that we're heading in the right direction.
Yeah, the Bar High organizational self-assessment toolkit is something that is publicly available for any health department to use. That can be a great way to set a baseline, and then you know, a department could certainly repeat it 5 years from now and see if it looks differently. We mentioned the City of Austin's Equity Office's equity assessment tool that's also available online. That could be another thing that people could look at to get some ideas about how to measure this, how to set a baseline. Another thing that could be repeated later on. And of course, eventually the larger goal would be that we do see real shifts in outcomes in the community. We know that's going to be a long project, though. It's not going to happen over the course of just 2 years or 5 years or probably even 7 years. But we do believe that in time, we're going to see more and more of that. The Government Alliance for Race and Equity also has some great resources on their website about data and measuring results. They have some tips about measuring, okay, what did we do? You know, how much, how well was it done? And then is anybody better off? So that's speaking to some of that final piece. I think our department at Austin Public Health has been through multiple cycles of this framework of visualize, normalize, organize, operationalize. I think more recently, we went through one in 2015 when the Equity Office was created, and we were kind of part of that conversation and part of that movement. And now we're in the midst of another cycle that was kicked off in 2020 with these national declarations on racism as a public health crisis and our own local declaration. And I feel like we're actually still at the beginning of this current cycle. A lot of our focus right now is on the normalize part. So the results that we have to speak about so far are mostly around what are people getting out of the Equity Academy and undoing racism. And we are seeing shifts in people's awareness of these issues, their understanding of these issues, their willingness to speak up publicly. I'm thinking of one staff member who at one training, and it was actually a different anti-racism training put on by Joyce James. She's done really powerful work in the state of Texas on these issues at the state level. So if you really want to talk to somebody about how to deal with those hostile environments, bring her in for a training. She's got a lot of wisdom to share. But let's see. So there was a staff person who was in one of those trainings, and I remember hearing her say, like, I'm being quiet because a lot of this is new to me and I'm taking it in. And then she was in an undoing racism training that we hosted in our department, and she was a lot more vocal in that training. And then at our recent all staff meeting, so in front of hundreds of people, she stood up and asked in front of everybody, our executive leadership team, to talk about their experience with racial justice work and why they thought it was important. And that was over the course of a few months. So to me, that's a pretty big shift from somebody who was maybe more of a passive ally to becoming a lot more confident in being an active ally. We've seen in our folks who do restaurant inspections, we've seen folks kind of start off our Equity Academy training like, well, I'm kind of hoping to see why we're doing this. I don't know, to towards the end, saying like, oh yeah, it's not just about individual meanness. It sometimes when you do have everybody follow the same rules without taking into account what's going on for them, things do shape up in really unfair ways. And then we asked them to identify action items at the end of the training. And one of them wrote down in all caps, language access for all. And I was like, wow, that's some passion. You don't write in all caps unless you really mean it. And that unit has really made some great progress with more use of our language access interpretation line, creating posters that have different food safety requirements in all different languages and with icons. So and then we also have teams who are already.
Natalie, we need to wrap up, I'm afraid, because I need to let people go. There's clearly so much to discuss here, and I hope we can have you back another time especially to see, at some point when you've got some even more of your results, and we'd love to check in with you again and see how it's going. And would love to hear from those of you on the call who have tried some of these practices yourself. Walker, if we can just put up the two final slides, we'll wrap things up. Thank you. So just want to real quick thank our funding partners who make this work possible, and then we can go to the final slide. Thank you so much to our guest speakers, Sandra and Natalie, today, and for all of you for participating in this. You can find ways to keep in touch with Big Cities Health Coalition here on the screen, including a QR code that you can scan to subscribe to our newsletter, which is really the best way to get a notice about our slides and the recording that we're posting, registration links for upcoming webinars in the series, and so on. Hope you all have a good afternoon or rest of your morning, depending on where you are, and thank you for being here. Take care.